Hi there. My name is Nicole Arruda, and today I will be presenting an evidence analysis library review of the research article, Lower Levels of Vitamin D Correlate with Clinical Disease Activity and Quality of Life in Inflammatory Bowel Disease. The objective of this study was to investigate the correlation between serum vitamin D levels and disease activity and quality of life in patients with inflammatory bowel disease, or IBD. Therefore, the research question was to determine whether or not there was in fact a correlation between serum vitamin D levels among these variables. Before we begin, it is important that we discuss some background information as to why this research question was chosen. IBD is comprised of Crohn's disease and ulcerative colitis. As we know, these are chronic inflammatory bowel diseases of the digestive tract, which involve deregulated mucosal immune response. Additionally, it is important to remember that vitamin D has been associated with immune response and gastrointestinal function. Those who wish to participate in the study must first meet a number of inclusion criteria. First, they must either have Crohn's disease or ulcerative colitis. Second, they must be ambulatory, meaning that they must be able to walk around and complete activities of daily living. Thirdly, they must also be 18 years or older. Those who were excluded from participating in the study were those with comorbid conditions interfering with vitamin D serum values. Such conditions include renal failure, liver disease, pregnancy or lactation, medications such as anticonvulsants, or additionally, the participant must also not be taking vitamin D supplements. As for the study design, this study was a cross-sectional study, meaning that it is a type of observational study used to analyze data among a given population at a specific point in time. This type of study does not observe cause or effect, but rather aims to distinguish a pattern or trend between the population and what is being researched. There were a number of methods utilized in this study. Vitamin D status was captured using serum hydroxyvitamin D via fully automated immunoassay analyzer. Quality of life was measured using the Short Inflammatory Bowel Disease Questionnaire. Disease activity was captured using the Harvey-Bradshaw Index for Crohn's disease and the partial Mayo score for ulcerative colitis. Each of these assessment tools was unique to the given disease state. And finally, SPSS statistics was used for the statistical analysis. This is a very well-known and respected statistical research software. With this being said, I believe that the methodology used in this research is capable of answering the research question, and that the most appropriate assessment tools available were utilized. There were a number of variables that were taken into consideration as well. First, the dependent variables, which were disease activity and quality of life. This type of variable is what is being tested and measured and depends on the independent variable. Next were the independent variables, which in this case were vitamin D serum levels. The independent variable is what the researcher believes will affect the dependent variable. And finally, the researchers also considered the control variables. These variables hold consistent throughout the experiment and are important to consider because while they aren't being measured throughout the experiment, they could alter the association between the independent and dependent variables. So it is essential to consider this when forming conclusions. The control variables in this case were disease duration, disease location, varying from the colon only, the small bowel only, or both, and IBD-related surgeries. The actual data sample consisted of 76 patients, 57 of which had Crohn's disease, making up 75%, and 19 of which had ulcerative colitis, making up 15%. The data varied also based on age and gender. Among ulcerative colitis and Crohn's disease, the average age was 33 to 35%. There was also a higher ratio of female to male participants, with females making up roughly 75% and males making up approximately 25%. The location was consistent throughout the experiment within northern Portugal, and the time frame was between July and August 2013 for all participants. The results of the research found numerous findings. First, serum 25-hydroxy vitamin D levels were low among all participants, particularly among Crohn's disease participants. Additionally, 68% of participants had insufficient levels of vitamin D, with 70% of all Crohn's disease participants and 58% for ulcerative colitis. Finally, 30% of participants were vitamin D deficient, without significance between Crohn's disease and ulcerative colitis. In regards to quality of life, there was an association between quality of life and lower mean vitamin D levels. This could be seen in the SIBDQ scores, in which the ones under 50 had the lowest quality of life, as well as the lowest mean vitamin D levels. From the given data, the article was able to form multiple conclusions. First, the researchers found that there was a high prevalence of vitamin D deficiency in irritable bowel disease patients, particularly among Crohn's disease participants. Second, clinical disease activity and activity of life both correlated with vitamin D deficiency. And lastly, the research concluded that there is a clear need for vitamin D supplementation in patients with irritable bowel disease. There were also a number of strengths and limitations to the research conducted. Some strengths to the research included the exclusion criteria that limited participants with altered vitamin D levels. Additionally, the research was collected in the summer, which provided consistency in daylight hours, which affects vitamin D levels. Some limitations to the data includes the small number of participants, which limits the statistical power of the conclusions formed. Additionally, there may have been potential selection bias, as only the mild to moderate irritable bowel disease participants were included in the final data. I believe this research to be significant to the field of nutrition and dietetics, as it is an important consideration when counseling a patient with irritable bowel disease. In regards to medical nutrition therapy in Crohn's disease, there is current evidence to support high calorie and high protein needs in this population, low fiber and at times low lactose, liquid vitamin and mineral supplements in their importance, and it's well known that these patients can malabsorb fat, fat-soluble vitamins, calcium, magnesium, zinc, and vitamin B12. In regards to ulcerative colitis, these patients are often advised to follow a low-fiber diet when needed. They also need to be aware of the need to replace fluid and electrolyte losses and bowel rest during times of exacerbation. However, it appears that there is little emphasis on vitamin D levels among this population, which might very well be an issue. And most importantly, How can we apply this research into our everyday work? While this was a relatively small research study, and I don't believe its conclusions are strong enough to recommend vitamin D supplements to all patients with irritable bowel disease as it had advised, I do believe that we should consider this research in our practice. As we do have a population here with increased nutritional considerations, I think that it would be important to advise these patients to select a multivitamin which also includes their daily allowance of vitamin D. In addition, we should also advocate for these patients by making sure that they're routinely checked for vitamin D deficiency. And finally, we should continue to stay up to date for up-and-coming research in this area, as it could greatly affect the health of our clients and alter our nutrition recommendations.